What's the language around vaccinations in your clinic? I mean, is this something that you expect to offer to people and expect to be able to deliver to them?
Thanks for having me on the show. It's still very early days for the vaccine and for everything that we're learning about the vaccine. What we're trying to do with our medical experts in-house is to fully understand the data and the efficacy of the vaccine once it's available. And then as it becomes available through the CDC and through Pfizer directly, we want to make sure that we're fighting for members of our practice to give them access to the vaccine that will be best for their care outcomes.
So for everybody who doesn't know, and that includes me, how concierge health services work, this is basically people paying per month or per year, is it? And what do they get in return?
So we operate a concierge medical service that includes 24/7 private medical centers in New York and Los Angeles, as well as a house call service in the New York tri-state area, in the Los Angeles metropolitan area, and in the Hamptons. And for people who sign up, they pay an annual fee for themselves or for their families. And what that includes is unlimited access to our facilities, unlimited visits with our physicians via telemed or in person, as well as a series of other procedures such as blood tests on site, COVID tests on site, and advocacy if they need to see specialists in the healthcare system. So people who sign up for concierge care are people who are considerate about their health and are looking to make sure that they're getting excellent medical care as well as getting treated with a good level of customer service.
Andrew, it's Robert Frank. Thanks so much for joining us today. You know, when I talk to a lot of concierge medical companies, they tell me, look, we're going to follow all the rules and protocols, but there may be others in the industry who don't. Do you think it's likely that in the next 3 to 6 months, we will be reading about a billionaire or two that somehow got a vaccine early? And how do you think other companies will be able to get it? Through which of these categories or through which of these channels do you think they'll be able to get a hold of the early doses?
Yeah, I mean, look, the easiest thing to do is to look back to COVID testing and how it became available. And certainly for the members of our practice, we as entrepreneurs and members of the private sector, we're fighting hard in order to get COVID testing as quickly as possible. And so on the back of that, we were able to find labs as early as in March where we could generate 24 to 48 hour turnaround times for COVID tests. And the simple reason we were doing that was because we wanted to provide the best level of medical care to the members of our practice, to our patients. We developed a robust treatment protocol around that so that we could care for people in home and try to reduce burden on the healthcare systems by managing people's COVID in the home. As a result, we had a much lower level of hospitalization, and we had very positive clinical outcomes for our patients who had COVID. I think now as it turns to the vaccine, it's going to be similar. All of us want to do only what is right for the community at large, for Americans and for citizens of the world. But equally, we want to use our commercial know-how to try to help get this vaccine distributed. And the more that we can help work with pharmaceutical companies and medical distributors to make vaccines more readily available for the patients in our practice and beyond, the better off for everybody. So we're certainly going to be trying to do that.
Andrew, it's Dom. Really quickly, before we let you go, how big is the concierge medicine field expected to be in the next, say, 2, 3, 5 years? And do people sign up, or will they sign up because they think that down the line you will give them better access to medication, drugs, vaccines, et cetera?
So at the moment, we think there's about 3 million Americans who buy the concierge products that you're talking about, which are $3,000 to $10,000 a year for an annual membership. The growth rate that the industry has seen is around 8 to 10% annually. And what we've seen is certainly an uptick in memberships. That uptick in memberships isn't specifically because people think we're going to provide them with better access to the vaccine, but they know what they're getting is a team of healthcare professionals who are going to work tirelessly to try to provide them with the best possible medical outcomes around COVID or around any medical issue. I think what's happened with COVID over the last 6 months is that it's accelerated a lot of trends that were already happening in healthcare. And that's essentially that people are becoming more conscientious about their health and looking to get service through non-traditional corridors, AKA not going to hospitals unless they absolutely have to, and being treated in the home if they can.
All right. Andrew Allen, Robert Frank, thank you guys very much for that.
Shepard Smith here. Thanks for watching CNBC on YouTube.